You started to feel it a few days ago, a weird, localized soreness right at the top of your buttocks. Now you can barely lie on your back, and sitting down is completely out of the question. You have a swollen, throbbing lump near your tailbone, and you're likely dealing with a pilonidal cyst. Because of the location, many people keep quiet about this and try to tough it out, but the intensity of this pain is significant. Patients regularly describe it as more severe than a tooth abscess or feeling like they're sitting on a knife. The sacrococcygeal area is packed with a dense network of sensory nerves designed to detect even slight pressure. When an infection develops here, pus builds up in an enclosed space with no natural way to drain. This creates a completely sealed environment under immense pressure, forcing fluid relentlessly against those highly sensitive nerve endings. The resulting pain is an inevitable result of human anatomy reacting to extreme trapped localized pressure. To understand why this happens, we have to look at the name itself. In Latin, pilus means hair, and nidus means nest. A pilonidal cyst is literally a nest of hair. These are pathologically classified as an abnormal pocket or cavity in the skin, containing shed hair, dead skin cells, and when infected, foul-smelling pus. While it contains hair, the pocket itself doesn't grow it. These are loose strands from the surrounding skin that have been forced into the tissue from the outside. Your immune system identifies these embedded hairs as foreign invaders. The excruciating swelling is a massive inflammatory response as your body attempts to wall off the invading debris. Forming these pockets require three specific ingredients: coarse body hair, constant friction, and vulnerable skin located in the natal cleft, the deep crease of the buttocks. The mechanism is driven by the hair's microscopic shape, featuring sharp, hook-like barbs. Sitting down creates localized suction, pulling the hair's sharp end downward, piercing the skin. Once inside, those barbs engage like a fishing hook, locking it in place. Over time, the friction of daily movement drives the hair deeper, and more hairs follow the same path. Biology and gravity effectively turn a single shed hair into a one-way biomechanical trap. Because of the location, patients often worry this is a sign of poor personal hygiene. In reality, pilonidal disease is strictly a mechanical pressure problem that affects even the most scrupulously clean individuals. We know this definitively from World War II records. The U.S. military saw such a massive spike in cases, they nicknamed it Jeep disease. Records show over 80,000 American soldiers were hospitalized for these abscesses. Bouncing in military vehicles over rough terrain created the exact combination of friction, sweat, and intense mechanical pressure required to force hair into the skin. Today, those same mechanical forces affect anyone who sits for long periods. Truck drivers, professional gamers, and office workers face a risk profile very similar to those soldiers. Developing this condition is a result of your body being subjected to specific biomechanical forces. It is not a reflection of your personal cleanliness. Resolving this requires physical intervention. Because the root cause is a mechanical hair trap, antibiotics alone will never cure pilonidal disease. Medication may calm the surrounding skin infection, but it cannot dissolve the embedded hair or close the underground cavity. Furthermore, you should never attempt to pop this at home. The deep blood supply and complex network of tunnels mean at-home drainage usually pushes the infection deeper into the tissue. When the pain is intolerable, a doctor can perform an emergency incision and drainage. They numb the area and make a small cut to release the trapped fluid, which immediately relieves that agonizing pressure. While the pain disappears quickly, a simple drainage leaves the underlying sinus tract, the actual anatomical defect, inside your body. Because the root trap remains, recurrence rates after this procedure are as high as 40%. Emergency drainage provides vital temporary relief, but it is not a cure. True healing requires physically dismantling the trap. Compare standard drainage to definitive surgery, like a wide excision. Here, a surgeon removes the entire disease tract, including damaged tissue and surface pits. Though it requires a longer recovery, physically removing this nesting ground drops recurrence rates to between 6 and 15%. For chronic cases, surgeons use flap procedures or the cleft lift. Rather than just cutting out the pocket, these surgeries shift tissue to flatten the deep buttocks crease. Eliminating this cleft removes the downward vacuum, bringing the recurrence risk below 2%. Long-term prevention also requires cutting off the supply of raw materials. Ongoing hair removal, particularly laser therapy, can stop the condition from returning. There is no reason to suffer in silence. Speak with a doctor